This is Dentistry Disrupted with Dr. Craig D. Clayton. I'm a wellness and biomimetic dentist, passionate change maker, social media thought leader, and educator on disrupting the way we approach oral healthcare. Come along with me as we journey towards a healthier and more empowered you. Hello and welcome to today's mini episode of Dentistry Disrupted. I'm Dr. Clayton, and today I'm excited to talk with you a little bit about periodontal pathogens, or the bacteria in the mouth that causes periodontal disease or gum inflammation, which then results in swollen gums, bleeding gums, bone loss, and in extreme cases, tooth loss. Recently, I have been diving back into some of the research about gum inflammation and the bacteria that cause it and its links to other diseases. Lately, I listened to a great podcast that was featured on Diaries of a CEO, and the doctor was Dr. Victoria. She is located in London, and she is a dentist turned microbiologist as well, and she has been studying a lot about the oral microbiome and the bad bacteria in there that cause disease. And it is just fascinating how many diseases these bacteria are linked to. So I wanted to highlight a couple of these as she discussed in her podcast, as well as diseases that I was already aware of before listening to the podcast. Later on, I will introduce someone I have been working with closely who was recently diagnosed with cancer. It's pretty well established that periodontal pathogens and periodontal disease have a correlation to various forms of cancer. They contribute to chronic inflammatory diseases such as diabetes. It also contributes to autoimmune diseases, dementia, Alzheimer's. These pathogens, these bad bacteria, periodontal disease increase your risk of contracting these diseases, or if you have them, of these diseases being worse. For example, diabetes. If the condition of the oral cavity is really bad, that can contribute to a difficulty in regulating blood glucose, which if you have too much glucose in the blood chronically, then that causes widespread damage to the body. So not good. It is thought now, through recent studies that are really some of them 2015, 2017, have established a correlation between and almost a causation, not quite. It's really dangerous to say that one thing causes another in medicine and in science at large. However, what has been found is if a patient suffers from a stroke or heart attack, if that clot is taken and analyzed, and if where the clot broke free is analyzed, a tremendous amount of bad oral bacteria are found in the clot as well as the area of the blood vessel where the clot broke free. And so the theory behind that is that these bacteria can accumulate, build up, and actually up to 50% of heart attacks and strokes may be stimulated or caused by oral bacteria, which is fascinating. And cardiologists really understand this well now. A lot of cardiologists are putting more weight into periodontal disease and oral health at large because they understand that this is a major risk factor for their patients. So the dentistry is more about overall health and oral systemic health than it is about teeth. And this is something we have to move away from. I like to say that cavities aren't going to kill you. Sure, if you get a cavity, it causes an infected tooth, that can cause a considerable problem. But just having cavities, needing to get the fillings or onlays or crowns or work is detrimental. It's a bummer, but it's the gum tissue and the oral microbiome that's going to cause significant long-term harm to your body. This is a long-term game. Bleeding gums are never normal. It's like if you were to press down on your fingernail and start bleeding from beneath your fingernail, that would be a concern, right? You'd probably schedule a call with your doctor, maybe even go to the ER because you'd be really freaked out. Yet, I sometimes hear from patients, and I hear in the community at large, like, oh, I'm just a bleeder. Yeah, I bleed every once in a while. Like, it's normal for me. It's like, no, this is not normal. That is literally a sign that these bacteria are breaking down the cellular wall that protects the mouth from the blood vessels. And when this gets damaged, that means those bacteria that are releasing toxins that are doing damage in the mouth are then free to enter the bloodstream and travel other places in the body. And this can contribute long term. We're learning that, for example, a bacteria called P. gingivalis is found in the brain of patients that pass from Alzheimer's, dementia. And what we're seeing is those bacteria are getting into the brain. They're releasing toxins called gingipains, and that can affect the brain cell's ability to use glucose, which primarily they rely on as the primary food source. And so if they don't have food, then the cells start to die. We also see this bacteria gather in the heart, and that can contribute to heart disease. So there's just all sorts of increasingly better established or more well-established connections between these oral bacteria and disease. Some other really interesting things: infertility. There was a study done on men and looked at the tie between periodontal health and the oral microbiome and the sperm count and sperm motility of these men that were having trouble conceiving a child with their partner. And what was found was a tight connection between fertility and periodontal pathogens. And so these men, when the periodontal disease or the gum inflammation was treated, within 3 months, 50% of these men's partners were able to conceive, and 80% of these men had a significant increase in sperm count and motility by just treating the periodontal disease. Another interesting fact: breast cancer. There was a study done looking at the breast microbiome of women diagnosed with breast cancer. And again, many of these women were found to have a high amount of oral bacteria in the breast tissue, in the breast microbiome of those ducts, of those milk ducts, of those glands that have their own microbiome. And so just that correlation. We're seeing that in genitourinary cancers. We're seeing that in kidney cancers or kidney disease. We're seeing a lot of connection and presence of these oral bacteria in other parts of the body, which is that evidence that it is getting into the bloodstream and traveling and contributing to disease. Another well-established connection is low birth weight. There was a study done in a part of the world that had a very high amount of women that gave birth prematurely and whose babies had very low birth weights. And these women at large had some sort of gingival inflammation or periodontal disease. And when that was treated, and given the treatment was actually pretty simple, there was a decrease in adverse birth outcomes when these pregnant populations. Some of the people in the study, the pregnant mothers, were treated, others were not, and these outcomes were different. So the health of your mouth is so much greater than just not getting cavities. Okay, so dentistry is really important in making sure that your oral microbiome is healthy, because every day you swallow about 5 grams of bacteria that goes into your gut, and that can have an effect on the gut downstream. It plays a major role in your health.
Okay, now I want to introduce you to someone I mentioned earlier.
The Hudson family, Anna and Aaron Hudson and their kids, just wonderful, wonderful people. And Aaron was recently diagnosed with cancer in 2021, and we are currently working with him to help heal his oral microbiome so that his oral health is not a contributing factor to the cancer. They're approaching this with a functional approach, working with so many different providers to heal all areas systemically in his body. They are a local business here in Kuna, Idaho, in the Treasure Valley where we live. The name of their company is Hudson Baking Co., and their bakery is the first farm-to-table bakery in Idaho. They make very unique sourdough. They source the wheat from the most sustainable sources, and a wheat that is better than the genetically modified versions of wheat that are non-organic. And they have a unique fermentation process that allows for better digestion of their bread. And as a result, a lot of people that are very gluten sensitive or gluten intolerant are able to, from what they've told me, are able to digest their bread okay and then enjoy these wheat-based products because the gluten is fermented and is at large eliminated from their sourdough products. And it's terrific. We love their bakery. They're such a staple in the community. In 2021, when they opened their bakery, he was diagnosed with cancer, and he fought it all the while building their business, pulling long hours alongside Anna in taking care of their clients and producing this wonderful product to our community. And this fall, that cancer returned and is now spread to his kidney and his back. All the while, he continues to work just so hard. He's an amazing person. He's a vet. The Hudson family is so important in our community. And this is a young family. Aaron is a very young 35 years old. Anna is 33 years old. They have a young family. And each holiday season, we've decided to support a family in need. And the Hudson family is the family we want to support this holiday season. And his story is really near and dear to my heart because I grew up in a bakery. My father owned a natural bakery similar to Hudson Baking Co. until I was 17. And I saw firsthand how difficult it was for my father to start the bakery and how much work it required over those many years of my childhood and formative years in my teens. And I see Aaron in the same amount of work he's putting in. And it is hard work. And last time he had his cancer surgery, he was back at work the next day. They've raised just over $21,000 from our community, which has been amazing. And their goal is to hit $50,000 to be able to pay for his treatment. And they do not have health insurance, so they are funding it themselves as a family and with the help of their community. Every contribution matters, and I want to ask that you seriously consider contributing even $1 to their fund. If more, $5, $10, $15, $20. If we all donate a little bit, it will help them reach their goal. We have such a large community, and I know that together we can get them to that $50,000 goal that will help him to pay for and fight their cancer, to help this family that is so important in the community, that's doing such amazing things, and a man that has served our country. And really, I really just plead with you that you will consider donating any amount to this family's cause. We will put the link to their GoFundMe in our show notes. Thank you so much in advance for your contributions. I cannot wait to see that amount raised go up in their GoFundMe account. Let's do it. Let's get them to the 50K. So excited to see those funds get raised. Hope you enjoyed this mini episode today of Dentistry Disrupted. Remember, dentistry is so much more than just the health of your teeth, and so much more than just repairing teeth and not getting cavities. Your oral health will contribute to your long-time lifespan and quality of health, quality of life.